Good morning. Welcome to the Partners Group webinar on improving health and productivity in the workplace. My name is Alexa Galizzo and I'm a managing consultant here at the Partners Group, and I'm going to be sharing today with you some ideas and strategies for how to implement a workplace wellness program into your workplace. I'm also joined today by Iris Tilley, who is a partner at Barron Lehman Attorneys, and then we're going to be joined by a special guest, Carla Toman, who is the Partners Group Vice President for Organizational Development. During this webinar this morning, we hope to share with you a number of different things. The first is we're going to focus on the benefits of a workplace wellness program, both from the employer perspective and then also from the employee perspective. We're also going to share with you a focus on prevention and talk about specific risk reduction strategies that you can implement in your workplace. We're going to highlight a particular employer and how they went down the path of implementing a risk reduction strategy in their workplace. Then we're going to invite our legal counsel, Iris Tilley from Barron Lehman, to come in and talk about health contingent wellness programs and some legal considerations there when moving forward with a health contingent wellness program. And then we're going to wrap it up with what's next in workplace wellness. What do we see on the horizon? The Partners Group for over 35 years has been specializing and working with our groups in health and wellness management services. Specifically, we focus in 4 key areas. The first one being employer services, traditional employee benefits, followed by data and health analytics. We also offer retirement planning services, and then lastly, we offer commercial and individual insurance. Within the Employer Services Division of the Partners Group, we focus specifically on offering our group's worksite wellness consulting services. We also specialize in data and health and analytics. We offer total absence management consulting services, and then we also specifically offer health prevention and program management services too. So to get us started this morning, we are going to ask all of you on the phone a question. So you should, in the next few seconds or so, we're queuing up a question for all of you to answer. And what we'd like to ask this morning is, how many of you on the phone are currently offering some type of a wellness program to your employees? It could be a one-time activity. You've offered a walking challenge. Perhaps you've implemented some worksite policies, including a smoke-free campus policy, or perhaps you've also transitioned from exclusively sitting desk to sit stand. Whatever it is, we're wondering how many of you out there have some type of a wellness program that you're currently offering to your employees. Like many of you, we follow a number of different industry associations, and according to a recent National Business Group on Health study, where they surveyed employers with less than 500 employees, 61% of employers offered general wellness programs. That's up from 51% last year. So we continue to see a real increase in employers offering some type of a wellness program. So just letting you guys plug in there your responses. Okay, so it looks like about 70% of our participants are currently offering some sort of a workplace wellness program to their employees. That is part of an increasing trend that I shared with you. It looks like on average about 61% of employers are offering a workplace wellness program. And it's likely because they're seeing benefits both to their organization and to their employees. Okay, so to get started this morning, we're going to look and talk a little bit about the benefits of an employee wellness program from an employer perspective. So when we meet with our groups here at the Partners Group, the first question we have when asked to be brought in and talk about wellness is, what's motivating you to put in a wellness program? And our employers cite a variety of different reasons, from we want to improve the health of our employees, we want to control our healthcare costs, we want our employees to be more engaged and satisfied on a day-to-day basis, even down to we just want to put some strategies in place that allow us to be a little more competitive in the marketplace. So there's a variety of reasons why people today are focusing and prioritizing on workplace wellness. The worksite is a great place to be able to showcase your support of an employee's well-being, and in return, we're hoping that we can begin to show the results of increased productivity, reduced absenteeism, improved job satisfaction, and more. And from the employee's perspective, what are the benefits of a workplace wellness program? Well, there are several. We know that employees who engage in a workplace wellness program for 6 months consecutively tend to see more positive results than those that don't participate. They have reported positive results like weight loss by participating in a weight loss program. They've experienced stress relief if a stress management program has been implemented, or even if there's a series of stress management speakers that come in and talk about ways that you can reduce your stress during the work day. They have noted that they have experienced stress release. Reduced health risks and or conditions. We're going to talk about this a little bit in greater detail throughout the rest of the presentation, but many employees, because they've participated in a biometric screening, have experienced reduced health risks. I know that one particular CEO of a company had been implementing biometric screenings at his company for several years, went down, did the biometric screening, found out he had high blood pressure. He went in to his primary care doctor, they got on a care regimen, and now he has his blood pressure managed. But he is now the firmest advocate for biometric screenings because he knows how important it is for employees to find out what their health risks are and do something about it. We also have heard from employees that it just makes them feel better by participating in wellness programs. Their work performance goes up when they participate with their peers in friendly competition. So many benefits to workplace wellness programs that really go beyond what might meet the eye. And even though employers are experiencing benefits from implementing workplace wellness programs, as are employees, as noted on the prior slide, they're experiencing weight loss, they're experiencing stress reduction. But despite these great efforts, our health remains at risk. We continue to see an increase in chronic conditions, and we continue to see a decline in our health status of our employees. The CDC, the Centers for Disease Control and Prevention, notes that chronic diseases and related lifestyle risk factors, those that you can control, are the overall leading drivers of healthcare costs for employers. So the riskier our behavior, the more likely we are to get a chronic condition, and then our costs continue to go up. We know that 50 to 80% of diseases are linked to the behavioral choices that we make. So by smoking, eating poorly, not moving, and having an increase in BMI, we're more likely to get a chronic disease. 4 of the 10 most expensive health conditions for U.S. employers, high blood pressure, heart attack, diabetes, and chest pain, are all related to heart disease and stroke, which account for 75% of healthcare costs in the United States. So the old adage, an ounce of prevention is worth a pound of cure. We absolutely believe that here at the Partners Group. And to figure out how to transition or impact the risk, we have to understand what it accounts for. So up on the screen here, starting on the far left, you'll see that 75 to 80% of employees have less than 3 risk factors, and those employees account for about 20% of the overall healthcare spend. Shifting then to the right, to the category of rising risk, those employees, about 15 to 20% of them have greater than 3 risk factors, but less than 9, and account for half of all the healthcare spend in the United States. And about 1 to 2% of employees have 9 or more risk factors, accounting for about 30% of the dollars spent on their healthcare. When I look at this, it really, to me, supports investing in health promotion programs to help inform decisions based on which risks are most costly and prevalent to their organization. So knowing where your risk is and being able to put in programs that address that risk and mitigate risk over time. Again, risk reduction is ideal. What we're looking for is risk transition. How do we begin to transition people from that 15 to 20%, that rising risk? How do we transition them to the well at risk? And how do we keep the well at risk well? Because within the Affordable Care Act, and many of you probably are familiar with this, worksite wellness programs have become part of a national public health strategy to address the increase in chronic diseases. Chronic diseases and related lifestyle risk factors are the leading drivers of healthcare costs for employers, as we already stated. So within the ACA, the Affordable Care Act, there was a specific fund called the Prevention and Public Health Fund that included many provisions designed to improve health and wellness in the workplace. There were 3 major prevention provisions, and the first one being waiving cost sharing for preventive services It included a provision to provide new funding for community preventive services and the use of incentives in the workplace, as a way to motivate employees to participate. One thing that I think is important to note is that, and we stress this here at the Partners Group with our groups too, is that before we can begin to talk about the type of prevention or the type of health promotion or disease prevention program that's going to be appropriate for your organization, we have to begin to shift the culture, to shift the focus from sickness and disease to one that's based on prevention and wellness. There are a range of activities and interventions aimed at reducing health risks or threats to an employee's health, and in the next couple slides we're going to look at those. So let's talk a little bit about primary prevention strategies. So these are aimed at preventing disease or injury before it happens at all. Primary prevention in the workplace really focuses on creating a healthy place of work, identifying and controlling stressors or barriers so that employees are engaged in their health, have access to healthy resources on site, and have access to programs to get them healthy and to help them stay healthy. It can be focused on the individual or the entire organization through group wellness or team-based activities. Again, primary prevention aims to prevent the disease from happening in the first place. And some examples of primary prevention strategies would be around kind of health education about healthy and safe habits, like exercising regularly, eating well, not smoking. Those are good examples of primary prevention strategies. Oftentimes we find that employers assume their employees know those things, but it's our job to continue to remind people of those good healthy practices and to create an environment where people can be rewarded and or be encouraged to practice healthy habits at work. Many companies offer lunch and learns about a variety of health topics or offer nutrition or walking programs. Again, those seem like things that may be somewhat outdated in a time where we're seeing all these new types of health management programs. But oftentimes what I find when I talk to employers who survey their employees is that they really still need that basic education about healthy snacks to bring to work, to keep them fueled throughout the day. They need that motivation to quit smoking. They don't know the resources to go to if they do want to quit. They don't know that there's an EAP available to them if they're dealing with some sort of a difficult situation. So it's a good reminder for all of us to continue to provide health education in all of our materials and communications that we're sending out to employees on an ongoing basis. So again, those are just some examples of primary prevention strategies. They're proactive, they're prevention or they're prevention focused, and they can focus on all employees and the organization. Moving to the secondary prevention strategies, and it's important to note that it's not one or the other. So they build upon each other. We want to make sure that we have a balance of primary prevention strategies, and that we're also, when we're ready, incorporating secondary prevention strategies as well. Secondary prevention strategies are really aimed to reduce the impact of disease that has already occurred. This can be done by early detection and treating disease early to halt or slow its progress. So good examples of secondary prevention might include return to work programs for people who are injured on the job, health risk assessments to report and record their health-related behaviors and indicate a readiness to change based on what they've reported. It also includes preventive exams and biometric screening tests to detect disease in its earliest stage. Again, as we go back to the couple slides earlier where we're looking at the kind of prevalence of, or the risk over all of the employees, what we're looking at is what we're trying to focus on is the removal of those health risk factors. The third type of prevention strategy is a tertiary prevention strategy. And this is really aimed at people who are managing long-term often complex health problems. It really aims to soften the impact of an ongoing illness or injury that has lasting effects. This can be done by helping people manage long-term, as I said, often complex problems and injuries, chronic diseases, permanent impairments, in order to improve as much as possible their ability to function, their quality of life, and their life expectancy. Some examples of tertiary prevention might include cardiac or stroke rehabilitation programs, chronic disease management offered through a carrier in your workplace for diabetes, arthritis, depression, support groups that allow members to share strategies for living well and access to materials that allow them to share with their peers, vocational rehabilitation programs to retrain workers for new jobs when they have recovered as much as possible. At this point, I'm going to shift over to my colleague Carla, who's going to talk with you a little bit more about a particular employer case study who has taken a prevention-based approach to managing both present and forecasted future risks. Welcome, Carla.
Thank you. As Alexa mentioned earlier, I'm a member of the Health and Productivity team, and in that role, I work with employers on their health improvement and wellness strategies, specializing particularly in hospital and healthcare systems. In fact, that is one of the case studies that I'm going to share with you today, is a healthcare system located right here in the Pacific Northwest that has 4,000 participants in their wellness program across 3 counties. So they're a multi-site, multi-distributed healthcare system and employer group. Now, if I gave you 30 seconds of silence to look at this slide, you would probably assess that this group experienced early on, in terms of the years that we're illustrating here, that they early on they experienced increases and spikes in their healthcare costs. And you can look at that and say, I can relate, the struggle's real, this looks a lot like our organization as well. And they took many of the typical, traditional, tactical approaches to managing those cost increases that they were experiencing, such as renegotiating current contracts, moving from carrier A to carrier B to save money, decreasing benefits for employees in the current health plan structure, and increasing contribution. And what was happening with regards to those strategies is that while they certainly do create effective short-term cost savings, this employer was struggling and tipping the balance or tipping the scale of employee satisfaction while providing competitive benefits in their marketplace. So they knew something had to change. Enter the partners group. In 2012, this particular client brought in the partners group to help them make a paradigm shift with regards to how they were addressing the health improvement and wellness of their employee population, and in effect, impact their healthcare costs as well. Because we know in the wellness industry that those traditional tactics I mentioned earlier, they're very effective at creating short-term cost savings, but they certainly don't bend the trend over the long term. The only thing that really bends the trend over the long term is addressing the health of the population, improving health performance and quality of life, which then in the future changes our health consumerism based on what our health status is and living healthier lives, or managing our diseases in a more functional way so that we're consuming healthcare benefits more appropriately. So in 2012, they brought in the partners group to work with them on an engaged strategy. An engaged strategy is essentially a health accountability program where the employer and the employee are sharing responsibility for the accountability of health. One of the things that we do in those strategies is we conduct health risk assessments and biometric screenings. We use some claims data where it's available, and we then identify where the health risks exist and lie within that population so that we can take a multi-pronged approach to directing that population to the interventions that are right for them based on where they are in the spectrum of health. And for the at-risk, rising risks, or current risk members, that could look like having interventions with their primary care provider so that they can have a proper diagnosis and maintenance of their care, participating in disease management services, or care coordination in order to manage their high-cost health experiences. Now, one of the first things that we work with with a client when we start their engaged strategy is the best practice is to put together a joint committee. And this particular employer started off just with that track by identifying the stakeholders within their organization who have an interest in impacting employee health. Now, the stakeholders for this particular employer and many large employers is employee wellness. This group actually had a group of employees who had started a grassroots effort at employee wellness before the partners group came into the picture. Some of their points of mission in terms of coming together and aligning their efforts was to foster a healthier workforce in a healthier workplace, increase personal health awareness amongst the members and employees, reward healthy lifestyle choices for employees who are currently practicing healthy lifestyle choices, and of course incentivizing and rewarding employees to start to move towards healthier lifestyle choices, and then of course increase that accountability and engagement amongst employees in managing their health care. As a result of that two-pronged approach, or that strategy committee that was put together. There's employee wellness and there's health plan. And of course, there's health and safety, as I mentioned as well. When the health plan resources, employee wellness, and health and safety all come together into the picture, they're able to leverage the resources that are available amongst that continuum of those groups in order to exponentially increase the services that they can engage their employees in with regards to managing their health. In this example, the employee wellness program under the worksite wellness component provided services such as a tobacco-free campus, which is very typical for many hospital and healthcare systems, but we would encourage non-healthcare clients to consider adopting a tobacco-free campus as well, having a flu shot campaign, on-site fitness centers, doing a great Biggest Loser competition to address their BMI health risks in their population, and of course, focusing on leadership. So one of the ways that they got leadership buy-in early was by having a walk the talk campaign, which was getting their leadership involved early on before putting these programs in place for employees, so that leadership could experience their own health improvement and be able to identify and personally experience just what they were going to be asking their employees to do, so that they could get behind that and support that. Now, the health plan also provided services, and employees could participate in both the on-site wellness services through the employer or through the health plan in two ways. One, by opting in because it was of interest to them to participate in those things, or two, by being directed by the health plan to participate in some of these strategies based on the employee's health risk as identified by the biometric screening, the health risk assessment, and of course the claims data where we were able to get that. Some of those programs, I won't read through all of them, included smoking cessation, a nutrition program, health coaching, and then of course the employees were heavily incented through plan design and contribution to participate in a wellness program, which required them to go through biometric screenings and a health risk assessment, and if asked based on their health risks to have a PCP encounter to see their primary care provider for further diagnosis and maintenance, that they would do so in order to receive that incentive. This particular employer enjoyed 88% participation in this strategy and have continued to see an increase and an incline in that participation each year thereafter. So let's get down to the bottom line, right? We all want to know what the results were that this group experienced. And this particular slide shows you that the percentage of at-risk participants, so again, I want you to pay particular attention to this slide. This slide is not showing you data for the whole population. It is showing you data for individuals who are at risk with one or more biometric metrics. And if we start by looking at BMI, and you're going to see the back of my head for a moment because I'm going to look at the slide up on the screen here. For those members in 2014 who were at risk for BMI, 76% of them experienced health improvement in that category in 2015. Of those members in 2015 who were at risk for BMI, 88% of them experienced health improvement in 2016. And as you can see by looking at this slide, each year that we saw exponential health improvement in each of their biometric values that were collected through this strategy of pointing them to both worksite wellness strategies and resources as well as clinical resources available through the health plan and their provider network. So I'm going to close by leaving you with 6 critical success factors for implementing an effective wellness health contingent based program. And again, I apologize, you're going to see the back of my head, so I can take a look at the same screen that you're seeing here. It all begins at the top with leadership support and gaining leadership buy-in. I had mentioned that this particular group started with a walk the talk program so that their managers, supervisors, and leaders could experience firsthand just what they were going to be asking their employees to do. Next is using data to inform the strategy. That includes biometric data, health risk assessment data. For those of you who may say, claims data isn't available to me, Carla, can you still work with biometrics and HRA? Absolutely. In fact, we could even work with an employee survey if health risk assessments and biometrics just aren't something that's practical for you to do in the first year or two due to perhaps budget constraints. Data-informed strategy, which results in an operating plan. All of us are leaders in an organization, most likely, who are on the call and know that we all have to start with an operating plan at the beginning of the year or at midpoint so that we know which direction we're headed, what our goals are, and how we know if we're going to be achieving those goals along the way. And that's exactly what an operating plan does. It informs the steps of the strategy. Following the operating plan includes communication. So we can have the best laid plans for our wellness program, but if we don't have people participating, frankly, we don't really have a wellness program, do we? Right. And what's the way employees know that there's a wellness program and resources available to them? It's through an effective communication campaign. So part of that operating plan includes an effective communication campaign that has a multi-pronged approach involving multiple channels of communication to employees. In that communication campaign, we're going to focus on the interventions that we are asking employees to participate and engage in. Again, those could include seeing their primary care physician to get follow-up care based on information received from a biometric screening, to participating in a Biggest Loser campaign, or letting them know there's a nutrition lunch and learn coming up, or there's activity classes that are available on site. It can be a variety of things that you're offering to employees in order to address what the health risks are within your population. So the communication campaign includes the intervention we want to direct the employees to, or we want to encourage them to participate in. And then of course, that intervention is supported through the environmental worksite wellness program that's offered through your workplace, as well as through the resources available through health and safety and your health plan. Thank you for your attention, and now I'd like to hand things back to Alexa, who's going to take us through a stretch break before we go through our second half of our presentation today.
Thank you so much, Carla. That was a really great overview of clearly a really successful engaged health management strategy from an employer's perspective. Okay, so this is a little bit of an experiment because typically when I do these, I am live, and I know I'm somewhat live to some of you, but I encourage at meetings for audience attendees to get up and take a stretch break, and that's exactly what we're going to do. So this is a low-cost, easy-to-do activity that we're seeing more and more employers do in the workplace to begin to encourage and really promote this idea of stretching, moving throughout the day. So I'm sure all of you have heard that sitting is the new smoking. So this aims at being able to put good practices in place to get us moving. So first, all of you up out of your chairs if you're not already. If you've been standing, congratulations. What I'd like you guys to do is we're just going to gently take our hands up in the air, and we're going to reach our fingertips towards the ceiling, maybe even get in a little back bend if you can. Come on, for those of you sitting, you know you want to get up. And I just want you to gently move, reach forward like you're holding a big beach ball. Reach towards your knees. If you can, reach towards the ground. Bend your knees gently if you need to. You don't want to put any pressure on your knees. And then just very gently move back up and place your hands by your side. And then lastly, I want you guys all just to take a really deep breath. And then just exhale, head out. That felt good. Let's take one more, just for good measure. So I've led that. All right, you all may take a seat. Great job. Thank you for participating. I've led stretching breaks over the years in many leadership forums in different groups, and sometimes they are met with some excitement and sometimes they are not. And over time, as I continue to do the practice, people are more and more likely to participate. And in fact, one time I took it out in a series of meetings I was facilitating, and when I didn't do it halfway through, the executive team stood up and started doing the stretching. And so it was a really great indication that, okay, it's working. Again, kind of simple, low-cost ways to promote prevention around unhealthy behaviors like sitting too much in the workplace. So thank you guys for joining me in that. So we're going to shift this portion of our presentation now over to health contingent outcomes-based programs, talking about the legal requirements, understanding them a little bit more, talking about the types of participation programs, and then again, as I said, talking about these health contingent outcomes-based programs. So we're going to start off by putting it back to you, audience. We're going to ask you a question here, and it should be up on your screen. How many of you are actively pursuing or already have in place a health contingent outcomes-based program? So, meaning your program does or will reward employees for achieving specific health improvements like improvement in BMI, reduction of tobacco use, improvements in your cholesterol, or blood pressure. So I'm going to go ahead and give you guys just a few minutes to respond to that. While you're doing that, I just want to mention 4 types of wellness programs that you may be familiar with, and Iris Tilley is going to go into much greater detail over the next couple slides around the legal requirements of putting in place health contingent outcomes-based programs into your workplace. But while you guys are responding to how many of you are actively pursuing or already have in place a health contingent outcomes-based program, I just want to really kind of quickly go through the 4 types of wellness programs. First one being health education and participation, not related to the health plan, and we'll go in greater detail into these a little bit later. Participation only related to a health plan, health contingent activity only related to a health plan, and then health contingent outcomes based, much like we said here, rewarding employees for achieving improvements in health related metrics. So it looks like that about 70% of you are not actively pursuing a health contingent outcomes based program, and about 20% of you are. And so that does not surprise any of us, I think, at this table. While many employers have added wellness programs to their health plan, some employers are reporting such low levels of employee participation in these programs, and because of that participation, they're looking for new ways to increase engagement in wellness programs and ultimately influence their employees to change health behaviors. And so because of that, interest in outcomes-based incentives has never been higher. Now certainly, as Carla mentioned earlier, we think that having a long-term investment in strategy is the right approach to be able to incorporate a successful long-term wellness program. And so while you may not necessarily be achieving high participation at this point, I wouldn't suggest just dropping that and moving towards an outcomes-based incentive program, but certainly if that's where you are at, we're going to use the next couple slides in the next 10 minutes or so to talk to you about some of the legal considerations if you are in the place where you'd like to at some point consider moving towards an outcome-based program. As I said, making that leap from participation-based to the use of outcomes-based should certainly not be taken lightly. And at this point, I'm going to introduce our legal expert, Iris Tilley from Barron Lehman, to talk with us about requirements needed when thinking about shifting to an outcomes-based wellness program. Welcome, Iris.
Thank you, Alexa.
So as Alexa mentioned, I'm going to be talking a little bit about the legal requirements that apply specifically to outcomes-based wellness programs. And we'll be talking really about 3 different bodies of legal requirements today. But don't worry, don't get overwhelmed. This really isn't a scary or daunting proposition. These are really just checklist items that you just need to be thinking about as you're putting your program into place. And then, of course, checking with your consultants when you're not really sure how things line up. So the first legal requirements we'll be talking about come directly from HIPAA, which you kind of probably know as a privacy law. However, HIPAA has a whole section where it's worried about discrimination based on someone's health. And so because of that, HIPAA comes into play when we're thinking about wellness programs and the way we apply these wellness programs to particular employees. We also had the Affordable Care Act kind of modify these programs a little bit. And so those are details that I think ultimately are unimportant, but if you're ever trying to gather more information, I wanted you to understand where these are coming from. So starting with these first 5 requirements, the first requirement is that the program must give individuals the opportunity to enroll at least once a year. And so what that means for you is that you're probably going to roll it out as part of your open enrollment. You have the option to offer it to new employees throughout the course of the year, but that's not something that's required because that new employee will also have the opportunity to enroll when that open enrollment cycle comes around. So that's something that you can certainly talk to your partners group consultant about exactly how you want to set that up. The second requirement is that the reward cannot exceed 30% of the cost of coverage. And we're going to be talking a little bit more about this 30% requirement when we get into some rules under the Americans with Disabilities Act a little bit later on. But just understand that the idea is that the reward can't be so great that someone would feel like they don't have the opportunity to say, no, I really don't want to be part of this program. And then the third requirement is reasonable design. And as you can see, I have some text on the slide that goes into this, but the idea is that this design really needs to be something that is designed to actually help someone achieve a healthy outcome. What the regulations are worried about is a program that is put into place and is ultimately too difficult for anyone to actually participate in. And really, it's kind of designed as this secret way to advantage certain employees and disadvantage others. But the bar on what a reasonable design is really quite low. The regulations use the example of aromatherapy is considered a sufficient healthy outcome. And so really you have a wide variety of options to consider when you're thinking about reasonable design. All right, so the next of these requirements is uniform availability. And what uniform availability means is that all employees who are similarly situated need to have access to the program. This means that if you have a business necessity that requires you to carve up your employees and have some employees under one program and some employees under another program, that's okay. However, employees who are the same from a business standpoint, they're in the same office, they're in the same division, whatever it is that kind of divides your employees, and there's no business reason that they would not be able to participate, they all need to have the ability to participate in the program. And ultimately that makes sense for you because it just means more employees are able to participate in the program and potentially achieve these healthy outcomes. The second requirement is that if you do have an outcome that an employee has to meet, whether that's a reduction in BMI or some other item, you do need to make an alternative available to those employees who are not able to meet that outcome. So if you have a particular employee who's not able to achieve that lower BMI, they just have to have another opportunity, whether that's nutrition counseling or something else, where they're able to go ahead and get that premium reduction, get that gift card, whatever it is that you're offering to those employees who do meet that outcome. The fifth and final requirement under the HIPAA rules is the notice of availability of that reasonable alternative standard. And so this is the idea that employees who have a medical reason that they're not actually able to meet that outcome or they're not able to participate in the wellness program just need to have notice that they have the opportunity to do something else. And you need to let them know within that notice that they can provide information to you that they're not able to meet it, and that if a doctor has specific requirements, that those doctor's requirements will be accommodated. So the 5 requirements that we just discussed under HIPAA, and as I mentioned also under the Affordable Care Act, are really designed to avoid a situation in which individual employees are discriminated against based on their health status. That's really the purpose behind those regulations. However, HIPAA also has some confidentiality rules that come into place when we're talking about wellness programs. And for a long time, those rules were really wishy-washy and we weren't sure exactly what to do about wellness programs. However, in 2015, we got a little bit more guidance on those HIPAA rules. And what those rules provide is that they clarify that where an employer is a covered entity, and when we're talking about covered entity, we're talking about whether the HIPAA rules apply to that particular employer. What matters is that they are a covered entity for purpose of the health plan, but there are a lot of situations in which that employer doesn't need to worry about the HIPAA rules when we're talking about wellness programs. And specifically, we have an exception that applies where employers don't have access to the personal health information that employees input into their wellness programs. And so imagine a situation in which your employees are filling out a health risk assessment. The typical arrangement for that is that you would use a third-party vendor who collects all that data and provides you aggregated information that doesn't have individually identifiable information. As long as that's how you're getting the information, you're not going to have to worry about jumping through a lot of HIPAA safeguards in order to get that information into place. However, if you are personally collecting that information and you know specifically which employee inputted which information, then that's a situation where you might want to get some HIPAA training because you're going to want to make sure that you're abiding by all of those each individual HIPAA rules. So the third and final set of laws, or I guess law that we're going to be talking about today, is the Americans with Disabilities Act. And under the ADA, which is the Americans with Disabilities Act, we had some new regulations come out in the summer of 2016, which take effect as of your first plan year starting on or after 1/1/17. So depending on if you're on a calendar year plan, they took effect on the 1st of this year. If you're on an off plan year cycle, then they would take effect when your plan year sets in. And we actually have already had a little bit of of action on these from the regulatory bodies. Just earlier this month, I should say the date specifically, on April 5th, 2017, the Equal Employment Opportunity Commission entered into a consent decree with a company based on a perceived violation of these regulations. And I only raise this to kind of get your attention and say, hey, let's pay attention during this part, because I know the legal guidance can be a little bit boring. But so how this ultimately played out was that the employer had a wellness program, and the wellness program asked for some information about individual employees' personal health conditions and included disability-related inquiries, which, as we'll talk about in the next slide, puts the employer's wellness program under the ADA rules. And how the program was set up was if an individual employee opted not to participate, that individual employee was responsible for 100% of their health premiums. If they opted to participate, the employer paid those premiums at a 100% level. And so ultimately that reward was too high under the ADA rules. And so the agreement that the EEOC came up with this employer was that the employer would pay $100,000 and would enter into some training. And so it's just a reason to pay attention and just make sure that the program does remain compliant. So as I mentioned, we had some new regulations come out under the Americans with Disabilities Act this past summer that went into effect as of 1/1/17, or the first day of your plan year thereafter. And so the question that always comes up is why we're even talking about the ADA. People think of the ADA as an employment law, not as a benefits law. However, these wellness program regulations relate directly to wellness programs, and the idea behind them is that the regulators want to ensure that those individuals who have disabilities don't feel like they don't have a choice as to whether or not to participate in a wellness program and to share information about their disability with their employer. So when these regulations apply, is any time a wellness program asks disability-related questions, so you can imagine a health risk assessment that asks questions that could expose a person's disability, or requires a medical exam. And this applies whether the program is outcomes-based, activity-based, any other type of program. If it has one of these two requirements, you're going to be under the Americans with Disabilities Act. So under the ADA, the program just needs to meet 3 requirements. And don't worry, one of these requirements actually overlaps the HIPAA rules, so these aren't going to be all brand new this morning. But the first is that the program needs to be voluntary. And we'll talk a little bit more about what that means as we're going forward. The second means that we have to meet these ADA confidentiality requirements that are very close to the HIPAA rules, but they're just a little bit different than the HIPAA rules, and then there's a specific notice that we'll talk about. And then the third is having a reasonable design. And that reasonable design really does just link back to those reasonable design rules that we already talked about. So considering those 3 prongs under the Americans with Disability Act rules, the first prong is voluntariness. So what does it mean for a program to be voluntary under the ADA? What that means is the maximum incentive that's available cannot exceed the ADA rules. And I talk about this a little bit more on the next slide, but those ADA rules do have a 30% rule, just like the HIPAA rules we already talked about. However, the calculation is just a little bit different. So we'll talk about what that means on the next slide. The program cannot be mandatory. And what that means is that you can't tell employees, if you don't participate in this program, you don't get access to health insurance. Or if you don't participate in this program, you're going to be fired. It can't be a condition of employment. And then employees cannot be excluded from a health plan. This kind of ties into to that mandatoriness. But I have seen situations in which an employer will offer 3 or 4 health plans, and one of those health plans will kind of be the wellness program health plan, and that employees won't have access to that health plan unless they participate in the wellness program. What the ADA rules say is, no, if you have a program that falls under these rules, you have to make that health plan available to everyone. So moving more into that voluntariness requirement. So as I mentioned, the maximum reward is 30% of the total cost of coverage. However, what we're talking about here is employee-only coverage. This actually differs from the rules under HIPAA. Under HIPAA, if you have a full family enrolled and that full family is eligible for the wellness program, you can consider that full family coverage. So it's just a slight difference in the way that the program is, or the way that the reward is calculated. So just consider that if you're trying to include that maximum reward. In a lot of cases, we find that employers aren't actually trying to fully get to that 30% level, so that often isn't an issue at all. However, the rule is just a little bit different. And I've outlined here the key differences between the HIPAA rule and the ADA rule just for your reference. As I mentioned, we're looking at family coverage in some cases under the HIPAA rule. There's also a special rule under the HIPAA rules that allows you to have a 50% reward for a smoking cessation program, and that actually doesn't exist under the ADA rules. And then there's also no cap under participation-only programs under the HIPAA rules. However, if that participation-only program either asks information that could reveal someone's disability or requires a medical exam, in that situation, we would actually have this 30% cap apply. All right, so the final of those ADA requirements is a special confidentiality requirement. And this is just a little bit different than that confidentiality requirement that applies under HIPAA. I think the HIPAA confidentiality requirement feels a little bit sometimes looser and a little bit easier to kind of push to the side. But these ADA rules apply whether or not you're considered a covered entity under the HIPAA rules. So how this confidentiality requirement works is that there's a specific notice, and I have a link on the next slide to a model notice, which is super helpful and really easy to modify for your own needs. But this model notice is supposed to go out to employees before information is collected, and then the model notice describes how it will be used, who will receive it, and how it will be kept confidential. So you would just go in and make modifications to that notice that meet your requirements as an employer. Employers are also only allowed under this situation to get access to aggregate information. Employers are not allowed to have specifically identifiable information about their employees. So you would really need to use a third-party service in order to collect that information, peel out the particular employee names, and then send it back to you. Employers may not require employees to agree to selling or exchanging their information. This is also a rule under HIPAA and something that I think that employers at this point in time would just never require their employees to do this. But this is specifically laid out in the rule, so I wanted to call it out. And then employers may not require employees to waive those confidentiality provisions as a condition to participating in the wellness program. So you can't tell employees, hey, you're going to get this great benefit if you waive these requirements. It's just specifically laid out in the rule that that's not an option for employers. And so I'm just going to wrap up the legal requirements here with a link to the specific notice that I mentioned. As I mentioned, under the ADA, there is a notice requirement, and very helpfully, the EEOC has published a sample notice that I've now customized for several clients. It's quite easy to customize, but of course, if you have any questions, get in touch with TPG or with me, and we can get it worked out for you.
Thank you so much, Iris. And as Iris said, we will be sending out this full presentation, so it will have all the information that Iris just presented, as well as Carla and myself, and the link in particular to that page, should you be interested. Just to kind of wrap up a little bit, we wanted to focus on beyond physical health. So as part of our agenda, as part of our agenda, we talked about what happens next? Where do we go from here? And so many employers are really engaged right now in improvements to employees' physical health. They're focusing on all the really good activities around getting their employees moving, getting healthier food choices and options in their workplace. They are incorporating ways for their employees to reduce stress. But what we have heard from employees that we've surveyed, and even from research that we've been reading, is that we need to look beyond just those physical triggers and those physical factors, and we need to begin to incorporate overall well-being, something that many people are calling total health. So really, whatever you call it, the idea is to be able to meet the employee where they're at with whatever need that they have going on in their life, and using the workplace as an opportunity to address and educate people on resources that they have available to them. Based on particular areas of interest, like I said, going beyond physical health. A really good example of that is financial wellness and financial health literacy. So we have a number of employers who now are incorporating financial wellness into their overall wellness design, because financial kind of stress or strife continues to be something that employees are dealing with, and employers up until now really haven't focused it on being part of their overall wellness program. They've kind of kept it to the side and said, well, here's some resources. We've got maybe an FAQ that can talk about retirement planning, but they really haven't dedicated an entire kind of pillar to it as part of their overall workplace wellness or well-being strategy. And so more and more we're seeing employers focus on providing resources to their employees that help employees manage their financial questions, their financial future, because certainly reducing a number of different stress factors like financial health can be an important way to continue to increase productivity and job satisfaction with their employees at work. Another area that people are incorporating into their workplace wellness program comes around health literacy. So we opt into health plan benefits and employer-sponsored benefit plan, and we then go on our merry way, and we're expected to understand our benefits. At the Partners Group, we take that one step further, and we really work with our employer groups to make sure that their employees understand the options that are available to them, whether it's continued interaction with their at employee meetings, making sure that they set time aside on a monthly basis to communicate to those employees that continue to have questions, or just putting together a general kind of FAQ for those employees based on what their particular needs are, what they need to understand about their benefit plan. Some other just quick things that I'll highlight here in the next few minutes while we have some time. Community connectedness. So another component of developing a total health strategy is this kind of understanding that people need to feel connected beyond just their own family or beyond just the workplace. So how do we look to the community, and how do we involve some of the efforts that we do on a day-to-day basis in the community back to our workplace? And so a lot of times what I'm seeing is, as a reward for employees who participate in a wellness program, one of the options might be, things like, of course, a gift card or PTO. Those are great things to reward employees for participating in a wellness program. But the other thing that's gaining in popularity is giving them an option to contribute or donate to a local charity of their choice, or take time out of their day to volunteer at a charity of their choice, or collecting a group of people within their own organization and going together as a group to a community organization and volunteering their time. So again, the trend looks like we are seeing interest in going beyond physical health and including things like financial wellness, health literacy, social influences, and community connectedness into a broader workplace wellness program. So with that, I want to leave you all with some really outstanding resources that are available to all of us. Many of these resources are free at no cost. I direct folks to these to get started, regardless of where you're at with your workplace wellness program. But this is a really good sampling of organizations, both here locally and nationally, that have evidence-based health promotion best practices that you guys can reference. Certainly, we at the Partners Group are happy to assist you and answer any questions that you have around the development of a workplace wellness program. Of course, Iris at Baron Lehman is always available too through the Partners Group to answer questions that you all might have around legal questions when setting up a wellness program. But again, I'll just highlight a few here that are kind of my go-to around resources that are really helpful in workplace wellness. American Heart Association Playbook is a great place to go. Certainly your carrier partners are excellent resources too to lean on. Oregon Public Health Institute. So there's a list there. So with that, we're just at the top of the 10 o'clock hour, and I just want to thank all of you so much for your participation in our webinar on behalf of the Partners Group and on behalf of Baron Lehman. Iris, thank you for joining us this morning.
Thank
and we
you.
wish you all a very well day. Thank you for joining.